calcium channel blocker, CCBS. So in this module we're going to learn about the mechanism of action, what are the indication, side effects, and how do you recognize these calcium channel blockers. So mechanism of action. So before we understand a mechanism of action, let's talk about the calcium channels. Calcium channels. So where do you find this calcium channel in our body? The first one you find in SA node, in heart you find in AV node, cardiac myocytes, which is basically the heart cell, and vascular smooth muscles. Now SA node, as we know, is a pacemaker. So what is the function of this calcium channel in this SA node, AV node, cardiac myocytes, and vascular smooth muscles? So they all have a calcium channel. When this channel opens, let's say here is a calcium channel, and this is a, let's see about this, this is a wall, this is like, let's say this is a cell. Either one of these could be SA node, AV node, cardiac myocyte, or vascular smooth muscles. Could be either one. This is a cell and this is calcium channel. When this channel open, all the calcium moves in. Calcium enters the cell. When the calcium enters the cell, it causes the contraction and contraction. Let's say if we are talking about the cardiac myocytes, cardiac heart cells, or vascular smooth muscle, it causes the contraction of those muscles. And if you're talking about the SA node and AV nodes, it causes the production of electrical activity. So it produces impulse. Okay, so that's the function of calcium. And I mean, there's so much in detail about the mechanism of action. How does the calcium enters, helps in the phosphorylation of the protein of these heart muscles and vascular smooth muscles. So as a nurse, we don't really need to know of in that detail. However, we need to know, like, when the calcium enters into the cell, it causes a contraction and also the produces the impulse. So calcium channel blocks these channels. When it blocks, it doesn't allow calcium to enter the cells, and when it doesn't allow calcium to enter the cell, it prevents contraction. So it will cause vasodilation. It will not let SA node and AV node produces the impulse. So if the heart is beating at 90 beats per minute, it's going to be beating at lower rate. So it decreases heart rate. It decreases conduction velocity. Now, if you remember, we were learning about the heart, especially the AV node. AV node is responsible for slowing the electrical impulse in the heart, and when we block the calcium channel in AV nodes, it's gonna even slow down the impulse more. So it's gonna decreases the conduction velocity in the heart, and it also gonna decrease the force of contraction in heart. So these are the effects when we block calcium channel in cardiac cell, SA node, AV node, and vascular smooth muscles. That it prevents the contraction, so it causes the vasodilation, decreases the heart rate, decreases the conduction velocity, and decrease force of contraction in heart. So that's the mechanism of action and the effects of by blocking the calcium channel in our body. So since we understood this mechanism of action, let's see in which disease condition we can use this medication for. So absolutely, for the hypertension, we can use this medication because this medication causes vasodilation in vascular smooth muscles. Now we use this medication for angina. So what happened in how we can use this medication? What is the main purpose that we can use these medications for angina? So it decreases the blood pressure. Absolutely, it causes the vasodilation. So decrease blood pressure, which is systemic vascular resistance. Now, when there is a decrease in systemic vascular resistance, ventricles can easily pump the blood out of the heart because it doesn't have to overcome up the high blood pressure. Now the blood pressure is low, so it can just pump blood really easily without so much effort into those dilated vessels. So it decreases the ventricular workload, right, by decreasing the blood pressure. And also you can say in the other terms that it decreases the afterload, which is basically the systemic vascular resistance, because if the blood pressure is high, the afterload is going to be high, which means if the blood pressure is high, the ventricle will have to contract really with really force and use a lot of energy to overcome that blood pressure and pump blood out of the ventricles. While the blood pressure is low, the ventricles won't have to create that much energy to pump the blood out of the ventricles. So the ventricle afterload is going to be decreased. When the ventricle afterload decreases, basically the heart workload is going to decrease, and heart muscle won't need that much oxygen in order to pump the blood out of the heart. So we'll decrease the amount of oxygen for heart cells, and that will decrease the angina. Okay, and also since this medication blocks the calcium channels in our body, especially the heart, it helpful in preventing the cardiac arrhythmia as well. Alright, so these are the main three indications we use this medication for: hypertension, angina, and cardiac arrhythmia. So what are the side effects of this medication? Obviously, the severe hypertension just causes the vasodilation. It can cause the significant bradycardia because, as we talked, that it also affects the SA node, that it decreases the production of that electrical activity in SA node, gonna decrease the heart rate. So it can cause the bradycardia, headache, and flushing, and also sometimes it can cause the reflex tachycardia. Now, this is kind of confusing, why it causes the bradycardia and sometimes it causes the reflex tachycardia. So here's an explanation. So this is our, let's say this is our aortic arch, okay? And in aortic arch, there's some special cells located right there. It's called the baroreceptor. Now the baroreceptors has certain nerves ending right like that sends the signals to the brain. So this is our brain, let's say brain. Now what does the baroreceptor detect? Baroreceptor detects change in blood pressure. So if the blood pressure is high, the wall's gonna stretch a little bit more. And if the blood pressure is low, the arterial wall's not gonna stretch that much. So what does this baroreceptor detect is the increase in and decrease in the blood pressure and sends signals to the brain. When there is a decrease in blood pressure, it sends the signals to the brain and says, hey, we have a decrease in blood pressure, we're not getting enough blood, the heart needs to pump faster in order to supply more blood. So if there is a decrease in blood pressure, heart rate will go up. Brain will increase the heart rate. If the blood pressure is high, the brain's gonna say, baroreceptors are gonna say, hey, we have too much blood pressure, we have too much blood, we don't really need that much. So it's gonna send the signal to the brain, and the brain's gonna say, okay, we'll decrease the heart rate so you won't get that much blood that you don't need. So it's gonna decrease the heart rate. Now, what does this calcium channel blocker does is the calcium channel blocker decreases the blood pressure, and when it decreases the blood pressure, it's gonna increase the heart rate by this baroreceptor reflex. Okay, that's how it causes the reflex tachycardia. Now, what are the contraindication and precaution with with this medication? You can't really give the digoxin because digoxin actually decreases the heart rate as well. So that's why you don't really want to give this medication, or be cautious when you're giving with the digoxin, because it can significantly decreases the heart rate. Beta blockers for the same reason, that it decreases the blood heart rate. Antihypertensive medication such as ACE inhibitors, ARBs, some other medication like you can say alpha blockers, some diuretics can also decrease the blood pressure. So any kind of hypertension medication, you want to be cautious that it doesn't decrease the blood pressure really significantly. Now, since this medication blocks the calcium channels, prevents the normal function of calcium, what if we give too much calcium? Well, it's gonna just nullify the effect of this medication. So if you're giving IV calcium to a patient, and if they're on calcium channel blocker, this calcium channel blocker is not gonna work. So this IV calcium blocker prevents the effect of this calcium channel blocker. And also, this is a thing to remember for NCLEX and for exam as well, is a grapefruit juice. Grapefruit juice significantly interacts with many of the medications and either decreases or increases their effect. So if you have a question, if you're not sure, usually the grapefruit juice, because you don't really want to give grapefruit juice with any medications, just to be like extra cautious. Okay, so grapefruit juice interacts with these medications as well. Now, how do you find out a calcium channel blocker? And as we talked in the first slide, that it works on the heart and it also works on the vessels. Now there's a way to remember which medication works on the heart, which medication works on the vessels, and which medication works on both. Now if you see on the right side, this amlodipine, nicardipine, nifadipine, nimodipine, felodipine, all the medication has DIPINE. So any medication in calcium channel blockers that ends with the DIPINE works only on vessels. That's kind of the trick to remember, that the medication that ends with the dipine, that's gonna work only on the vessels. That means it's gonna decrease the blood pressure. However, it's not gonna decrease the heart rate, is not going to decrease the force of contraction or whatever the effects this medication has on the heart, because this one works only on vessels. Now if you see this examples on the left side, diltiazem and verapamil, their names are different than other calcium channel blockers, like they don't end with DIPINE. So this one works on the heart and works on the vessels. So that's how that's kind of a little trick to remember that their name is different than other medication in the same class. So they works on the heart and vessels both, while the other these drugs works only on the vessels. And especially just kind of interesting thing to know or to remember, this nimodipine, it can cross blood brain barrier. So blood brain barrier, also called as BBB, and that is the reason we can use only this medication to prevent vasospasm in the brain. You can't really give any other calcium channel blocker to prevent the vasospasm in the brain because they are not able to cross the blood brain barrier. This is the only medication, nimodipine, can cross the blood brain barrier and can prevent the vasospasm. And this is the mostly used medication on neuro ICU, because they have a like an aneurysm, they get the aneurysm fixed, and after there's a high chance that they'll have a vasospasm, and they need to be on this medication for at least 21 days in order to prevent any incidence of vasospasms. Okay, so that was it about the calcium channel blocker. If you have any questions or any concerns, you can email us or contact us. Thanks for watching.